Welcome, everyone. So I guess I'm going to give you a first-hand experience of how to advocate at your NDIS planning meeting. So really explain the role of what you can do as an individual advocate to get the best out of your NDIS plan. I'm just going to put a disclaimer up. Really, it just says that this is the information best to my knowledge today that I'm going to present to you, and it doesn't necessarily reflect the views of the NDIS, but it's my personal views on what I think is the most important information to think about when you enter your planning meeting. So I'm going to give you a little bit of an overview about the talk today. So, what is reasonable and necessary supports? And I guess they're really the core basis of the NDIS, because if the NDIS doesn't think something is reasonable and necessary, they're not going to fund it. I'm going to give you some tips on preparing for your NDIS planning meeting, talk about the planning meeting itself, plan lengths, and some useful tips. So what is reasonable and necessary? You might hear people talk about reasonable and necessary, and it relates to a section of the NDIS Act, Section 34 in the NDIS Act 2013. And it clearly sets out supports that will be funded under the Act. So it needs to be able to assist a participant to achieve their goals and aspirations. It has to support a participant to engage in activities so they have increased social and economical participation. It's got to demonstrate value for money. The NDIS is not going to support something that they don't think is good value for money. It's got to be effective and benefit the participant. So it's got to be a proven therapy that has results. They're not going to fund going to a clairvoyant, for example. And they're going to fund what they believe is the most appropriate service funded the NDIS. So they're not going to fund something that they think is better funded by the health system or the education system. Sometimes these areas are a little bit grey and there should be some overlap, but that's when it all comes down to the planner, what they consider to be a support funded by the health system or education system. And the NDIS needs to take into account what's reasonable to expect with informal supports and the community to provide. So often you will hear in the case of children, oh, we think that's parental responsibility. But we all know that if you are supporting a child with disability or complex health conditions, it's often the equivalent of parenting 3 children. It's not your typical journey. So having said that, they also will only fund supports that are related to the person's disability. So they're not going to fund a holiday if it's got nothing to do with the person's disability. They're not going to fund everyday items. So they're not going to fund your basic shopping at the supermarket, because they would say an everyday person who doesn't have a disability is expected to purchase those items. So the person with a disability is too. And it can't duplicate another support already provided by the NDIS. And you might hear that a participant asks for music therapy in their plan. But if you have a speech therapist who also integrates music therapy into the supports they provide to the participant, the NDIS would deem that a duplicative support, so they wouldn't fund that music therapy in your plan. And of course, the NDIS does not fund anything illegal. So how would you go about preparing for an NDIS meeting? I always think the more prepared you are, the better outcomes. And look, it doesn't always follow. We know the NDIS can be a bit inconsistent at times, but I always say the better prepared you are, the best chance you have of getting the supports you ask for. So I think it's a good idea to prepare a participant statement, or if you're a parent of a child on the NDIS, a carer statement as well. So that's where you would describe what life is like for you. So for instance, if you're a participant living with Mito, you might say, some days I really struggle to get out of bed. You tell it how it is and think about how you are on your worst day, because we know Mito is a fluctuating condition. So you've got to be prepared for when you have those difficult days. So usually you might write maybe 300 words, you paint a picture, talk about, things you can do, things you really struggle with, what supports you have in place, both informal, with if you live with a partner, or community supports you access, maybe the support of your medical team. And then you'd present that to your planner or local area coordinator. And I think it's really good to do a bit of a pre-plan document and actually email it to the planner prior to your meeting. So they've had time to read it and you're not going in cold to your meeting. I would develop some goals. So if you have a goal to be able to, dress yourself independently, then you'd list that as one of your goals. I think it's a really good idea to prepare a weekly schedule about what a typical day looks like. So if you wake 4 times in the night, then put that in your weekly schedule. So the NDIS have an understanding of what supports you might need overnight. I think it's a good idea to review your current plan and think about what areas you really like with that current plan and what areas you'd like more support in. And I always think it's good to have specialist reports because they're the evidence, and the NDIS needs evidence before they will fund what supports you're asking for. It's so much easier if you've got a speech therapist who've said, I recommend that the participant needs weekly speech therapy so we can work on swallowing, for example. So I always think it's good to have your goals and the specialist goals be on the same page, and then you've got more chance of getting that support funded in your plan. So think about supports, what to ask for. And I often look at the pricing guide, and that's on the NDIS website. And I kind of treat it like a shopping list. So you know the types of supports they will fund. So what I do is look at the pricing guide, look at what I think's relevant, and then I would work with the specialists and say, what do you think about this? Do you think this support would be helpful? And then hopefully they can write a letter with the evidence around it so you can get that support funded. So I think probably, the average pre-plan, it probably takes you around 6 hours to prepare. And then you've also got to work with those specialists, gather the reports. It's so much easier to go into a meeting with reports than go into a meeting with a blank page. I also think it's a really good idea to take a support person into the meeting with you because often you're put on the spot and you might forget some things you wanted to bring up in the meeting. So sometimes people take a family member, sometimes they take a therapist. I just think it's really good because you are emotionally involved, whereas a support person may not be. So think about what's working well and really know what you want out of the planning meeting, because you can't always rely on a local area coordinator or planner who may not know your situation. They might know nothing about mitochondrial disease, and they certainly do not understand what life is like for you. No one's going to advocate for you like yourself or support person or a therapist. And you've got to remember there's still a lot of local area coordinators and planners who are still learning on the job. They're learning about the NDIS. They're learning about rare genetic conditions. And I said, really think about the goals, because the NDIS is goals-based. They want to show that you've achieved some of the goals that you've set out to achieve in your plan when you have your next plan review. Now, you might not have achieved them, but if you can demonstrate that you've been working on them and utilising the supports in your plan to achieve the goal, that's going to work in your favour. Think about the funding you've had in previous plans. Was it sufficient? Do you have lots of funding left over? Because if you've got lots of funding left over, the NDIS might think, well, actually, you don't need that much funding in your plan. So if you haven't spent all the money, you might want to document the reasons why. For example, you might have spent 4 months in hospital, so you couldn't actually attend your weekly speech therapy. At the planning meeting, they may run through a formal questionnaire with you, or they might just have more of a chat informally, and that means the planner would fill in the questionnaire outside of that meeting. I think you've also got to present your case on a worst day, and I know we always want to see the positive things in life, but we've got to be realistic here. If you want to get the supports you need in your NDIS plan, you've got to demonstrate what a worst day would be for you. And, I think we're at a disadvantage when we have a rare disease, because often we don't know enough about the rare disease. It's hard to explain to someone that it can be episodic, it can fluctuate, things can regress very rapidly. So I always think it's really good to have a plain English fact sheet on Mito and have some dot points. Don't have it in medical jargon. Have it in plain English, and prepare that prior to your meeting. Send it to the planner. But also you can upload all this information onto the portal. I always think it's better be prepared, and if a planner's had a chance to read all this information prior to your face-to-face meeting, which I would be advocating for, then they've got a better understanding of your condition, and I think you'll get a better plan. So, some useful tips. I spoke about reports, and really make sure the reports provide the evidence to what you would like in your plan, what supports you need. I spoke about the support person because you're emotionally involved. Know what you want. Don't leave it up to the planner to suggest things. Certainly they are welcome to suggest things, and they may suggest things you haven't thought of, but you really should go into a planning meeting with a clear objectives as to what you want out of your planning meeting. Planning meetings are stressful. You don't want to be doing them every 12 months if you don't need to do one every 12 months. And with the review, we will see longer plans, and it may be you just have a plan at different life stages. For example, if you're a child, it might be when you start school, it might be when you leave school. And I would say talk to other participants, talk to other members of the Mito community and say, what worked well in your plan? What didn't work well? What do you think you should have asked for? You can never underestimate that value of peer-to-peer support. So you don't have to do this alone. And I'm sure the Mito community members are happy to support one another. And if it's a child, remember that parents are often their child's best expert. And as an adult with Mito, you know what it's like to live with the condition much better than a local area coordinator or planner who has no experience of Mito. And then try and get it right the first time. You don't want to be doing a reassessment or review of a reviewable decision. The terminology keeps changing on what it is, whether it's an S100 or putting in a change of circumstances at S48. It's so much easier if you can get it right the first time, because it takes a long time to put in a review, for the review to be taken up. So the more information you can provide, the more evidence you can provide, the more prepared you are, the best chance you are of getting the right plan for you at that point in time. So thank you. That leads me to the end of my presentation.
Thank you for joining the Role of Self-Advocacy webinar, part of our NDIS webinar series. We've already heard from Heather Renton, who spoke about the role of self-advocacy and some of the tips and tricks for having your planning conversations. And now I'm going to talk to you about all things NDIS and when things aren't going according to plan. The NDIS is a revolving door of change. It's extremely important to keep yourself informed and up to date with the changes that are occurring. In October 2023, a rollout began of the NDIS's new computer system and My Place portal. In the long run, this system is meant to be much more user-friendly. However, there has been some troubleshooting, and from our experience and understanding, this has been causing significant delays. If you haven't already had an upcoming plan review, participants' new plans will be completed within the new pay system, and then you will be introduced to the My Place portal. The rollout of this system has also changed the process and interaction with early childhood partners and local area coordinators. The role of the partners in the community is to collate all of the information and provide this information to the NDIS. A planner will then hold a planning meeting with you and finalise your NDIS plan. In November 2023, the final report from the NDIS review was published. There were 26 recommendations and 139 actions that were identified. The Mito Foundation published an article on what this means for the Mito community, which is located on our website. The NDIS has a participant service charter, and this is part of the participant service guarantee and gives us timeframes for crucial NDIS processes. It is broken down into getting started with the NDIS, getting a plan, changing a plan, making a complaint. The Participant Service Charter helps individuals manage expectations around the agency's decision-making timeframes, and it provides us with a reference point for when things aren't happening the way that they are intended. This also provides us with good information to support an escalation pathway and provide evidence in making a complaint if necessary. If you can see the small table on the PowerPoint, you can see that the performance is measured for each quarter that the NDIS has. So the data that we've currently got is from the quarter of September 2023. So we know from our experience and from what the community is telling us that actually these timeframes are not happening, and there has actually been quite a significant blowout of people waiting. So things are taking a lot longer, which is something to be mindful of if you are requiring a plan review or a change of circumstance. So something to take into consideration. The NDIS has several review processes that are available to participants if they're unhappy with a decision or require changes to their plan. There can be times when we disagree with the decision that the agency has made, or they haven't considered all of the evidence we've provided, or something has been missed. And these review processes are to ensure that individuals receive plans and funding packages that are reflective of their needs. We have plan reassessments that can be participant or agency initiated, previously known as S48s or a change of circumstance. Internal review of a decision, previously known as an S100, or a review of a reviewable decision. And then going to the Administrative Appeals Tribunal, the AAT, which is an external review of the NDIA. With regards to the internal review of a decision, this can be applied for when you are unhappy with the NDIA's decision. This must be made within 3 months of that final decision. Examples of an internal review would include if you have attempted access and have been declined, or when you initially get a plan and you feel that there are supports missing or haven't been included in that plan. For a plan reassessment, a participant can request a plan reassessment if their current plan does not meet their needs or there have been significant changes in function and the participant requires an increase in support. The other thing that I will note now is that a lot of plans are being rolled over or continued. The agency stipulates that within the letter that you receive from the NDIS regarding a rollover or a continuation, you can request a plan review at any time within the life of that new plan. So if you decide to take on a rollover because there's a lot going on and you just don't have time to have a meeting, so the funds of that plan will roll over at the end, the plan end date. If within 3 months you decide, actually, this is not going to be enough, or my needs have changed, or I need some assistive technology that wasn't included, you can then call your local area coordinator or early childhood coordinator and organise for a review to take place. Again, this will be timely because there are massive delays at the moment, but it's something to be mindful of, that you don't need to put in a change of circumstance if you have had a rollover review. You can just ask for a plan reassessment. When we're looking at evidence to support the review process, we want to make sure that we have as much additional information as possible to provide the NDIS with updated evidence. And this just ensures that the process runs smoothly. So what type of evidence is good evidence? We want functional evidence. We want to provide the NDIA with specific examples of what it is and why we require that support. We need reports that document what has changed and what supports are needed. And when we're thinking about assistive technology, we want trials and quotes and the correct NDIS documentation for those. The NDIS provides funding to people with a disability in order to access the NDIS funded package. A person needs to have a permanent disability, meaning lifelong and significant. And it needs to have a large impact on a person's ability to complete everyday activities. This means that when we're looking to seek access to the NDIS or we are looking at a plan reassessment, we need to provide the evidence to the agency of why we need this support. The NDIS talks about 6 domains of function: mobility, communication, social interaction, learning, self-care, and self-management. Unfortunately for people impacted by Mito, the challenges, the difficulties, and the symptoms that are faced are often not understood or well documented. Providing the NDIS with documentation through reports from allied health professionals, particularly occupational therapists, who can provide comprehensive functional capacity assessments, can assist to ensure individual needs are reflective in their plans. Feedback and complaints is a really important aspect of the NDIS. I'm encouraging the Mito community that speak to me to see feedback as a positive, as it assists in highlighting processes and systems that aren't working. Feedback allows for change to happen, and if no one knows what's going on, how will they fix it? If you are unhappy and want to give some feedback or make a complaint, you should start by contacting your partner in the community, either your early childhood coordinator or your local area coordinator. If this doesn't get the response that you require, ask to speak with a team leader or a manager so that this matter can be escalated. At the same time, it may be beneficial to use the NDIS online feedback form and it has just been updated as of the beginning of March. We can then go a step in front. The Commonwealth Ombudsman is where participants can lodge a complaint against the NDIA and the NDIS Quality and Safeguards Commission. We can speak to our local federal member who have a contact within the NDIA where they can raise local complaints. And we can also contact the Minister for the NDIA, Bill Shorten. If you have concerns or a complaint around a provider, the NDIS Quality and Safeguard Commission is the place to make your complaint. If you are needing more support, please contact the Mito Foundation helpline and connect with me, the NDIS Navigator, for one-on-one coaching and support. Sometimes my service is just around being a sounding board and talking about, what is happening and, brainstorming how to have those conversations with your local area coordinator or your planner. Thank you for your time.